Hello, you guys. It's your favorite nurse, Nurse T. First and foremost, I want to thank Lisa for offering me the opportunity to come and speak to this amazing um, group, this amazing organization, Women Reign Network. I know this network is full of business owners, entrepreneurs, women who mold and shape our future, game changers. So I'm excited to be able to speak before you guys and share this life-saving information. Today I'll be talking about the COVID-19, formerly known as the coronavirus. Now, before I go further, two things I want to point out. First thing I want to point out is the time. I'm not sure how long I will be able to do the video in relation to the ability of me being able to send it. So I'll try to condense my information. And two, I want to be transparent. I want to be blunt, straightforward with you guys. I want to deliver the information in a manner where you can digest it, go home and regurgitate it to your loved ones. I want you to have the ability to explain to your 7-year-old child the importance of washing their hands 20 times a day. I want you to be able to explain to your senior the magnitude of this disease, of this virus, and why they had to miss their senior year. Okay, now COVID-19 is vicious, it's virulent, it's very powerful. It attacks the body and causes rapid deterioration. The medical community has not seen anything this powerful in a very long time. Now, you guys know how to protect yourself. It's the social distancing and hand hygiene. Social distancing is 6 feet. I personally, I do my best, my very best to do 10 feet or greater. Now, the importance of social distancing is when someone speaks, coughs, sneezes, projections of saliva come out their mouth. If you're close to them, it has the ability to land on your face. Now, this virus, at least right now, is not crawling and moving. But last time I looked, which was a couple years ago, there was some data out that says that we will touch our face at least 60 times in 1 hour. So if someone's droplet, saliva, spit lands on your face, you rub your face, you rub your nose, you may have just rubbed that infected drop of saliva to your nose. You rubbed your eye, you rubbed it to your eye. Now, this is the point of transmission for this virus. Right now, the way that we can get this virus is the virus crosses our mucous membrane. Our mucous membrane is the moist covering over our eyes, in our mouth, and in our nose. So right now, the virus does not penetrate your skin. The mode or the barrier is no, the barrier is not the word that I'm looking for. But basically, the virus enters our body through our eyes, nose, and mouth. Okay, our skin is our biggest defense mechanism, and right now research says that it is working fine. They have not determined that the virus penetrates the skin. Now, hand hygiene is so really big right now because the virus has the ability to live on inanimate objects, which are non-living objects. COVID-19 has the ability to live on a desk, on a doorknob, on a gallon of milk container, on dollar bill, on just about everything. So that's another one. That's another reason why the government is following up with the recommendation of the CDC to enforce people to stay in their homes, or encourage people to stay in their homes, because we cannot say what is already contaminated and what is not. And with the unknowing comes the risk of you doing self-contamination. You touching a wall, touching the mailbox, and then there you go. You touch your face, you rub your eye, you just transmitted the virus that way to you. Now let's talk about some of these signs and symptoms of the virus. So we have the cough, dry cough, the runny nose, itchy eyes, fever. But I also want to share with you guys, this is the end of the flu season, so we still have flu around. It is, and the flu has some of the same symptoms. It is springtime, and with spring comes seasonal allergies. Seasonal allergies, sneezing, coughing, irritated, itchy eyes. So just because someone is coughing doesn't mean they have the virus, but you don't know the difference. And I'm going to just tell you straight up, ladies, I know that COVID-19 is a respiratory disease, but I'm an emergency room nurse. And people present not just with respiratory issues. Some present with nausea, vomiting, and diarrhea. This is their complaint. They're COVID positive. So I'm telling you that the symptoms, there is no cookie cutter symptoms. You cannot say just because a person has a cough, a fever, it's COVID-19. Because basically there is no symptoms. That's just a fact. If you are sick, if you're coughing, sneezing, runny nose, sore throat, congestion, diarrhea, nausea, vomiting, you need to implement the self-quarantining. If you want to reduce the risk of this virus being spread to your loved ones, then initiate self-quarantine. That is where you stay isolated from anyone, from everybody, for at the minimum, 14 days. This will give the virus time where it is highly contagious to run its course, okay? Right now, there is no cure. There is no treatment. So let's talk about when you need to come to the emergency room. If you're sick, the emergency room is a place for people who are gravely ill, for people who are on their deathbed. I'm not discouraging you from coming to the emergency room, but I just want to let you know that when you're under the weather, your first point of contact should be your medical professional, your primary care physician. Your primary care physician, if you suspect that you have coronavirus, your primary care physician can direct you to where to go to get tested. Your primary care physician can prescribe you medication as well as follow through with your treatment. When you come to the emergency room, there is limited things that we can do there. And again, you want to save the emergency room for those that are gravely ill, those that are with difficulty breathing. And a lot of times right now in the emergency room, we are not actually doing the testing for COVID-19. So again, if your loved ones are sick, if you are sick, it's recommended that your primary care physician be your first person, first medical profession that you reach out to. Okay, let's talk about mental health as it relates to this COVID-19. I know I saw the president today say that there's approximately, they're stating that approximately between 100,000 to 240,000 people may die because of this virus. Now, first, let me start off by saying that there is a God, okay? And just because they think that doesn't determine what God say. Okay, so that number that they put out is just what they, and when I say they, that's you know who they are, the powers that be. Whether it's the government, the federal government, the CDC, the World Health Organization, they don't have the final word, okay? So don't become overwhelmed and boggled down with this information. Don't become overwhelmed with receiving information on COVID-19, about COVID-19 from Instagram, from Twitter, from Facebook, from Messenger. It's in our emails. We're seeing it on the news. We're reading it in the newspaper. We're reading it in magazines. It's all on billboards. It is important for you to have a reliable source, but do not get overwhelmed with information regarding COVID-19. Yes, it is important for you to stay updated and in the know of relevant and knowledgeable information, but don't become overwhelmed with it. Because when you are overwhelmed about something that is out of your control, then it is easy for you to slip into depression. It is easy for you to have physical illnesses like migraines and high blood pressure. So instead of being occupied with coronavirus, COVID-19, do your part in protecting yourself. Do your part in protecting your loved ones. Implement the social distancing. If you or your loved ones are sick, implement self-quarantining. Avoid the crowded places. If you can hold off on going to the market, going to the bank, going to your cousin's house, your girlfriend's house, do those things. This is important because you don't know if your favorite cousin contracted the virus from her coworker. Sometimes symptoms are not present. Again, the symptoms are not always coughing and sneezing. So right now, practice the social distancing. Practice the self-quarantining. Reach out to your primary care physician. You can do it now. I recommend doing it now. Hey, doctor, do you know where they're doing the free testing? Are you doing the testing at the office? If symptoms are present for you, don't wait till the last minute to find out how to get tested. Reach out to your primary care physician now. And then, before I end, you know that with the social distancing, a lot of the primary care physician offices has closed down and are doing telemedicine or telehealth, where they are seeing you over your phone. And what is happening, health laws have changed in response to the coronavirus. Okay, so you can actually talk to your doctor. It's legal over the phone. There's no violations. He can assess you over the phone. He can take your symptoms, your verbal, he can take your verbiage about your systems, about your symptoms as fact and order medication for you and order treatment for you. Prior to the coronavirus, the doctor had to, okay, let me verify that these symptoms are legit before I can prescribe medications. But the coronavirus, COVID-19, has caused the health laws to be adjusted to assist in social distancing and reducing the risk of the transmission of the virus. Okay, this is your girl Nurse T. I hope this video has been helpful. Again, what I want you guys to take is how to be safe, how to protect your loved ones and your family, and let's just stick together, stay at home, and protect yourself. Goodbye.